We've also seen a significant change in the payer mix. So not only have the volumes gone down, but the payer mix has changed. And this has been more of the Medicare, Medicaid population, which takes into account the HCAHPS and the Press-Ganey scores and the patient satisfaction scores when they're determining the reimbursement to the institutions. So how you're managing these patients' pain and how you're contributing to that is really, really important and going to be looked at by your employers, by your institutions. So pain assessment and patient satisfaction is going to be very, very important going forward if it hasn't already been, of course, which it has been. You're listening to Pediatric Pain Focus, episode number 46. Today, we're talking about why this is the right time to hone your pain care skills, especially when it comes to children's pain. So, stay tuned.
Pediatric Pain Focus.
You're listening to Pediatric Pain Focus, brought to you by Proactive Pain Solutions. Pediatric Pain Focus highlights pediatric pain information and provides tools and resources for all healthcare professionals taking care of children dealing with pain. Here's your host, Dr. Anjana Kundu.
Hello there, my friends. Welcome to another episode of Pediatric Pain Focus. I'm your host, Dr. Anjana Kundu, and today we're going to tackle a somewhat controversial topic because not everybody agrees with this. I'm talking about why pediatric pain care is everybody's responsibility to some extent and why it makes most sense to currently invest your time in improving and elevating your pediatric pain care skills. We all know that the practice of healthcare has been changing, right? We've seen it, which, it's a really good thing in many ways, but we also know that change brings challenges. It brings hardships with it as well. Change is necessary for evolution, whether it's personal, professional, or societal change. And it also is the hardest thing to face for anybody involved. And talking of the change in healthcare practice, we have definitely seen a much more prominence of this change, and it's been very evident with the advent of technology. But especially in this past year, it's been absolutely precipitous. With the pandemic hitting the world, our limits as healthcare professionals have been tested. We've had to examine the rigidity of the practice structures that bound us. We've had to forego many of the safeguards and the guardrails put in place by the regulatory agencies. We have also had to push our own personal capabilities beyond their limits. We've had to adapt very quickly to the changes, the uncertainties, and many may have been unforeseen, but some that we had been toying with for a while but had put them aside. For example, telemedicine, right? Because our current practice was working. And often we are of the mindset, if it ain't broke, don't fix it, right? That sometimes actually leads us to complacency instead. But then we saw the pandemic and we had to hold all our elective and non-urgent healthcare issues. We had to put them aside in order to care for a condition that was completely unknown to us, that we were so uncertain about, we felt powerless about. And this sense of powerlessness, uncertainty, and ignorance, although we felt it much more amplified in the face of a COVID-19 pandemic, but that is one of the most dreaded things amongst healthcare professionals. And it is not unique just to this condition. We know that. That sense is always very haunting when we experience that. It's very anxiety-provoking on top of that. And as healthcare physicians, we deal with a lot of anxiety-provoking times where we do feel powerless, uncertain, and to some extent in the dark or ignorant about it, right? And one of the best ways to deal with that anxiety that comes from this kind of setup is to confront it. Chances are, to be honest, that most of us as healthcare professionals, especially physicians, are always leaning into it and are always confronting it as well. But wouldn't we want to do this with more confidence, with some more tools at our disposal, and with a sense of certainty? Yes, that's an oxymoron, a sense of certainty in times of uncertainty. Pressing on with just courage, without skills, without some additional support, can only take us so far. How can I or you comfort a patients that are suffering? How can we comfort them, their families, or even our own selves if we are worried sick, if we're anxious and we are uncomfortable, right? So what we need is some ways, some tools to actually help us understand pain and the suffering our patients and families are going through, right? Because if we don't do that, we'll eventually get to a point of burnout. And when we're burned out, we develop a sense of apathy, which then takes us to a point where we don't even recognize that it's a problem. So what we need to and want to do is be the professionals that we are. Be professional, be competent, have some sense of a handle or control of the situation, and feel prepared to some degree. I know we're not always going to feel that way, but having some basic level of those characters is important. So now you may ask, what does that have to do with pediatric pain? Well, pediatric pain is still a relatively less understood, poorly understood, or misunderstood, frankly, specialty. And of course, everyone feels like it might be somebody else's responsibility to take care of it. There are often statements like, children's pain scares me. It takes too much time. It takes too much effort. I don't want to have to deal with difficult parents. Oh my God, I can deal with the patient, but that parent, I don't need two patients. You know what I'm talking about. These are some of the common statements that I'm sure you may have heard or thought about at least. But the fact is, pain is the biggest driver of patients' experiences throughout their hospital or healthcare journey. And how that's managed is going to determine what their perception of their experience is. You also heard me say over and over that there are only a handful of people that have specific expertise in pediatric pain management. And you don't want to be waiting for those specialists to come by and solve the issues of your patients that you take care of day to day, who also are experiencing pain issues to some degree all the time across the hospitals. Why? Why do I say that? Because the studies, the data, the research shows us that pain is most ubiquitous experience in one's healthcare journey. 1 in 3 children in the United States report chronic or recurrent pain. And this is 1 in 3 school-age children between the ages of 6 to 18 years, which approximately comes to about 19 million children. And we have about 500,000 surgeries every year, which are also associated with acute pain. And we're not even talking about some of the other trauma and illnesses. So think of how many children are experiencing these pain symptoms across their healthcare experiences. Over 68% of all ER visits present with pain as one of their symptoms. And 62% of hospitalized children report moderate to severe pain experience, and this doesn't take into account some of their mild discomforts. So you see, as I said, pain is ubiquitous. So no matter where you are practicing, what your area of specialty is, you are likely to encounter pain issues in your patients. Do you now want to wait for a pain specialist to come help move these patients through the system and allow you to be able to do the job that you have to do to address the main issues that they're coming to you for? I don't think so. Now, granted that there will be situations where you need to call a pain expert, but for the most conditions, you can at least get them started on the right path. You can give them the assurance that you care about their pain just as much as whatever other structure that you are working with, whether it be surgery or treating their other medical conditions. And talking about other medical conditions, the prevalence of pain with other chronic or more complex healthcare conditions can be as high as 80%. For example, cancer, right? And talking about cancer, the survival rate for some of these chronic, complex, and cancer-related conditions has improved with the advent of science, technology, and medicine. But this chronicity of the condition still persists, and it is associated with some pain, as are the treatments. Some of the treatments that we use for our cancer are very pain-inducing themselves. They result in neuropathic pain, chronic fatigue, chronic myalgias, and many other pain issues. And because these children are presenting again and again for these treatments or for different procedures, their systems are being primed for pain generation. And if these are not treated adequately and preemptively, then this develops into a lower threshold for pain, higher chronicity, and higher rates of persistence. And this chronic, persistent pain then impacts all areas of their healthcare. It will impact all the hem-onc providers. For example, if we're talking about the oncology patients, it will also impact how the nurse cares for them, how the nurse practitioners or the hospitals that are covering overnight, the psychologist, the physical therapist, and the list goes on and on. So you see, my statement about pain being a ubiquitous experience is so much more relevant than sometimes we tend to recognize. And unfortunately, the biggest issue with pediatric pain is that it remains under-recognized and undertreated. And studies have also shown us that the lack of awareness and misconceptions on the part of healthcare professionals is one of the most common causes of undertreatment of children's pain. I'm hoping through our Pedia Pain Focus series, and by the end of this episode, I will have at least given you some thoughts about why it's relevant and why it is important for you, regardless of the area of practice that you're in, it is important for you to develop some basic pain care assessment and pain care skills. Another very important issue is the fact that there's a vicious cycle of pain. Children with untreated pain grow up to become adults with chronic pain. And a higher incidence of chronic pain amongst parents and adults in the household leads to a higher incidence of chronic pain in children themselves. So you see how this feeds itself and becomes a self-fulfilling prophecy, which we obviously don't want to propagate. Now you may say, well, I don't want to take care of these patients. Why can't we just send them to pain specialists? I've already mentioned to some extent that there are only limited number of healthcare professionals. You've heard me say again and again that there are very few avenues to provide adequate training, let alone specialty training for pediatric pain medicine. And therefore, the wait times can be as long as 6 to 12 months for these children to see a pain specialist. So then who's taking care of them in the interim? Most likely you, right? If you've had a interaction with these patients, they will be calling you, they will be connecting with you, or simply will feel completely abandoned. That propagates a sense of mistrust beyond the abandonment. And the longer you wait to treat pain, the more chronic and refractory that pain becomes. On the flip side, earlier and more appropriately you treat pain, you can help these children return to completely normal or near normal and therefore improve the long-term outcomes from these treatments. You can avoid the chronicity. You can avoid these children growing up to becoming adults with chronic pain and adults with higher incidence of mental health or other chronic issues or disabilities. And another important factor is that inadequate knowledge around children's pain or appropriate assessment and management of children's pain is a key contributor to the opioid crisis. And this, I guess, is not unique to just children, but inadequate knowledge around appropriate pain assessment and treatment of anybody's pain, adult or pediatrics, contributes to the inappropriate treatment options such as the opioids and therefore the opioid crisis. So if we understood the basic concepts, you can make better treatment plans, better treatment options for your patients, and therefore the scrutiny around when and how you use opioids would be much different. Now you may say, great, this is all about the patients. What's in it for me? Well, let's look at that perspective. From a healthcare professional's perspective, although our primary responsibility is to make an accurate diagnosis and provide an evidence-based, efficacious treatment plan, as a physician, we can't ignore the overall experience that these patients need to have through our system. And even to give them those evidence-based, efficacious treatment plans, we need to understand the underlying issues by themselves, right? We as physicians, we can't afford to heal a patient without attempting to make them happy at the same time about their overall care, right? So we have to pay attention to their comfort, be it physical or emotional, at the same time as diagnosing and treating any condition, be it pain-related or not. So the bottom line is that we need to pay attention to the patient satisfaction. Why? Because patient satisfaction drives the physician satisfaction, it drives the institutional satisfaction, and it's not just about the satisfaction, there are way more things that are tied to it. Your productivity, your outcomes, your patient's engagement and adherence to treatment, they're all tied into how well you care for that patient and that family. Now you may say, well, we have a pain team. The pain team can take care of all these patients. Why do I have to do this? Sure, if you have a pain team and they can address every single patient in your hospital very promptly, kudos to you. I want to know who you are and what institution you're part of because, wow, that is unicorn situation, and I definitely want to know and meet you. For the rest of us, we may have pain services, but there are only limited number of patients they can see. They can't take care of the numbers that we already discussed that span across the healthcare institution, which means the patients are going to be waiting and they will feel ignored, not taken care of. They will suffer and the outcomes will suffer. And then there are those institutions that actually don't even have the basic pain care services, right? So we have to make sure that no matter where a patient presents, they are given some degree of pain care regardless of their institution of choice. Some basic pain skills need to be part of all healthcare professionals' armamentarium because it affects patient satisfaction, as we said, which in turn impact the clinician's satisfaction. It affects the patient's healing. It has physiological impact on their cardiorespiratory system, their immune system, and all their physiology in general. So happy patients make for happy healthcare professionals. And, these are basically two sides of the same coin. A change on one drives the change in the other, right? And if you don't believe me, all you have to do is look at the Press-Ganey scores, the Hospital Consumer Assessment, and Healthcare Providers and Systems Assessment, which is the long explanation for what we know as HCAHPS scores. And the HCAHPS data now, which every hospital or clinic or healthcare practice is required to fill out, and it has been tied to the reimbursement that institution gets. Reimbursement can be increased based on these scores. And one of the biggest drivers of these scores is patient satisfaction based on their pain care. Now you may feel like, oh my God, that is a lot of stress on me. Why do I have to think about it alone? But think of it this way. If all of us thought that it was our responsibility to make the patient feel as comfortable and as acknowledged and satisfied, at least ask about their pain and help come up with a plan to address their pain. It may or may not be you who is eventually addressing that pain, but as long as you assess it and direct them in the right direction to the right service, the right professional, they will feel so much more satisfied. And how they've had an experience with you or the previous healthcare professional before you will absolutely color their perception of the experience they've had. So if each one of us took this responsibility on and did our best to address and move them along the path of help, their overall experience is going to be improved. And like I said, happy patient, happy physician, better outcomes, better reimbursement, and therefore happy institutions. Happy institutions, you have a job security. So you see how this is all tied together? Now, talking about job security and satisfaction, physician satisfaction, let's take a look at what some of the things are that drive a physician's or a healthcare professional's job satisfaction. You'd be surprised to know that there are factors rated way more higher than the amount of salary a physician or a healthcare professional receives when it comes to drivers of their satisfaction. Your job satisfaction directly correlates with your physical and mental well-being. It's also associated with the well-being of those under your care, right? We already talked about how your satisfaction will determine how you take care of these patients, their outcomes, their engagement into their own treatment processes, right? And if they think you care, they feel much better and their outcomes are better. So for you as a healthcare professional, satisfaction is a major contributor and a driver of burnout. Your patients' healthcare outcomes, including their healthcare quality, their patient satisfaction, adherence to treatment, interpersonal relationship, and trust, are also driven by your degree of satisfaction. And so what are your drivers? Number one, it depends on whether you enjoy your work or not. And to be able to enjoy your work, what you need to do is to be knowledgeable about the care you provide your patients. You need to be skilled at it. You need to feel somewhat comfortable and confident, even if it means that all you need to do is recognize the degree of the problem and then refer them to someone else who may be more appropriate to provide that treatment. But your confidence and your knowledge about that will help you feel more empowered and will help you enjoy your work even more. Now you may say, well, I don't enjoy doing pain management. Instead of thinking of it, oh my God, pain is a burden, think of it this way: I'm making a difference in patients' life, their experience through the healthcare journey. Another driver of your job satisfaction is whether you receive any rewards or recognition. And again, rewards and recognition can actually be trophies and medals and certificates and recognition awards that are bestowed upon you by your institution or nationally or regionally. But they can be simple things. Were you able to make a patient smile? Were you able to help them navigate the system a little bit better, right? Studies have identified that physician satisfaction is associated with patient satisfaction, which in turn is dependent on the healthcare professional satisfaction level, right? So round and round it goes. So I know I keep coming back to you. For your happiness, it is important that you make your customers, which could be your patients and families, which could be your institution, your administration. If you make them happy, more satisfied, you'll feel more satisfied. And they will likely bestow these awards and recognition based on whether it's contributed positively to a situation. Driver number 3 of your satisfaction is you having the opportunity to learn new skills and grow, or having opportunities for advancement, whether it is in your clinical practice, teaching, research. And as I said, one of the biggest area of impact is how a patient's pain is cared for. So if you can make a difference in that, you will have a higher degree of satisfaction yourself. Driver number 4 is to be able to make good use of your abilities and skills to make a difference. And according to a RAND survey, the RAND Corporation study, they show that the quality of patient care is the primary driver of a physician's satisfaction. So it all comes back to satisfaction, right? And finally, another thing that is very important and an important driver in a physician or healthcare professional satisfaction is the ability to have a work-life balance. Now, if you think about pain management, on one hand, you may say it can be very demanding. But on the other hand, as I've been repeating again and again, all you have to do is to be able to assess, evaluate, and direct them to what the next steps would be, right? Most of the times, pain is not an emergency situation. It is urgent because you don't want anybody suffering. You don't want your patient to be suffering. And suffering is obviously more than just the physical nociceptive experience. It's your emotional experience, right? So it is not an emergency situation. You know that you're not necessarily going to have a life and death impact on this patient or the family's situation. However, you will have a major impact on their quality of life and their perception of the quality of their care that they received by doing the simplest thing. The pace is slower for you, but the outcomes, the impact that you're getting is immediate and massive. Therefore, chances of you having a better quality of life because you're dealing with less urgent, less stressful situations at a slightly slower pace. And if you are in an area such as emergency medicine or HEMONC or in ICU or anesthesiology, all of these areas, as you know, are very high demand, urgent care areas. So being able to have the pain care skills allows you to slow that pace down a little bit. It may even give you a better option towards the later part of your career when you're not seeking that adrenaline rush from doing emergency life-saving maneuvers. This may still bring you the amount of adrenaline rush, and dopamine rush, but mostly from doing something to improve somebody else's quality of life. Now you may say, well, you started out by saying why it's the right time to invest in pediatric pain management skills. So how does this tie into it? Fine, you were supposed to make them more satisfied. I can do that by doing what I'm doing anyhow. Hear me out. Here are a few things that you need to consider in the current state of affairs. The current state of healthcare, especially after the year we've just had with the pandemic, things have changed dramatically. I'm sure you've read and heard about physicians being let go because there's been significant loss of income and financial impact. Physician groups who've been frontline COVID warriors have been let go of at this point. Why? Because they are thought to be replaceable. They can be replaced with cheaper or more versatile options that might be out there. And what makes you more versatile is having additional skill, having a skill that few people might have. That is what's going to give you a little more longevity, a little more stability in your career. Based on the last year, we have a data from study conducted amongst pediatric hospitals, especially in the pediatric anesthesia departments, that showed that about 40% of physicians are thinking of either quitting, making a change, or retiring. We also have some data, as I said, that there have been layoffs, including those of physicians. Physicians have been let go. We also know that there have been a cut down in fellowship training programs. They're being eliminated, or from the physician's perspective, they're not being preferred because they need to have the sense of security of practice and the income that comes with independent practice rather than being a trainee, such as a fellowship trainee. We've also seen a significant change in the payer mix. So not only have the volumes gone down, but the payer mix has changed. And this has been more of the Medicare, Medicaid population, which takes into account the HCAHPS and the Press-Ganey scores and the patient satisfaction scores when they're determining the reimbursement to the institutions. So how you're managing these patients' pain and how you're contributing to that is really, really important and going to be looked at by your employers, by your institutions. So pain assessment and patient satisfaction is going to be very, very important going forward if it hasn't already been, of course, which it has been, but it's going to be even more scrutinized going forth. Now, because of the loss of income, institutions are going to look towards improving their reimbursement in any possible way that they can, whether it is the reimbursement that they get from the payers and or increase the productivity and or find clinicians that can be versatile and provide more services than their current ability. Now imagine if you're not providing a certain service, that will impact the referral to your center, where the patients go. So if you're able to provide them pain care, your other specialties are affected by the quality of care that you are able to provide them. Another thing you can't ignore, especially as a physician, is this fluidity or the blending of the boundaries of scope of practice. When the institutions are faced with financial hardships or financial hard decisions to make in light of our year that we just had in 2020, they are forced to consider cost-cutting measures and see if there are other healthcare professionals that can do that job than having to pay a physician. However, with a skill as specific as pediatric pain, you still are relying on a physician at the moment, at least to lead the team, so therefore your role still remains pivotal. You as a pediatric pain physician can not only change and alter the quality and safety of the care these patients receive, you're also improving the throughput, right? More efficient pain management, improved throughput of these patients through the systems, and better pain scores and better satisfaction scores translate into better reimbursements. And that in turn translates to your own security and satisfaction. So bottom line for the positives of career in pain medicine, especially pediatric pain medicine, especially for a physician at this point, are your likelihood of having improved wellness, your improved job satisfaction, your contributions to quality improvement, safety, productivity, and improved satisfaction scores, as well as better reimbursements, as we've talked about. There is risk reduction for you, right? As I said, these are less urgent, less life-threatening situations. Therefore, the level of liability and risk is lower. So you're living a lifestyle with relatively lesser risk. And as a healthcare professional, as a physician, you can drive the change in healthcare through quality improvement, through safety, satisfaction scores, throughput. You can set the standards of pain care within your institution locally, nationally, or even globally. You can impact the bottom line of the institution. High patient experience scores can boost the hospital's net margins as much as by 50%. And that was according to a recent Accenture study. Listen, we are already facing a healthcare crisis related to the pandemic, which is all but natural to be followed by a financial crisis in healthcare especially. So it makes sense to have skills that are unique, that will showcase your versatility, that will help you emerge as a leader, help you advance the QI, the safety, the productivity, as well as throughput of an institution, and help improve the bottom line, the satisfaction scores, and the recognition, accreditations, and business of that institution. And for you, it will provide a quality of life that is better suited to you, less risk-prone, and improves job satisfaction as well as ensures job security for you. And above all, as Nelson Mandela said, history will judge us by the difference we make in the everyday lives of children. So, make your imprint. Make it the best possible you can. Now, I hope this episode helped you think through why it makes sense for you to have at least the basic pain care skills, even if you don't choose to become a pediatric pain specialist, because how you set these patients on this path to recovery is going to determine the speed, the quality, the ability of recovery for these patients, and not just for pain, but all areas of their healthcare. And I hope I provided you some thought-provoking ideas, and you would consider perhaps incorporating a little more pain skills in your practice. And if you need resources, Pedia Pain Focus has plenty of episodes that will help you do just that. And should you choose to explore it even further, we also offer a Physicians Academy program, which is a 12-week program that goes way in depth of assessment and management, how to establish yourself as a leader even with or without the title, how to build efficiency in your workflow, how to improve your productivity, and how you can have better negotiation skills. So if that is of interest to you, there's a link to our Physicians Academy in the show notes. Check it out, and I will be happy to walk with you on that path and get you to your desired outcomes. Folks, that is it for today. Next week, I will be back with a guest speaker, Dr. Fiona Campbell from Canada, who is actually on the healthcare task force for the Canadian government. And we'll talk about the importance of some of the policy work and how policy work starts at the ground level, right from your everyday work, as well as it is top down from a place such as the task force. So how you hold the power to influence your area of practice as well as the quality of care that gets provided to those under your care. So I hope you'll join me in 1 week. In the meantime, let me know in the comments, what are your feelings about the role of pain care skills for every healthcare professional? Do you agree with me? Especially if you don't agree with me, I definitely want to hear from you and your reasons for that. Thank you once again for joining me today, and thank you for your continued love, support, and your suggestions on the different topics. This was definitely another one of those topics that was a question that was asked by a listener, why they should bother to invest in pain management. So I hope I've answered them as well as given you something to think about. So I'll see you in a week's time. Until then, stay safe. Be proactive. Bye now. Pediatric Pain Focus is a presentation of Proactive Pain Solutions, a company committed to transforming pediatric pain care through improved access, quality, and expertise. Did you know that there are only 4 accredited pediatric pain medicine training programs in the US? Meanwhile, there are 19 million children that suffer from chronic pain. This means the children's pain care is largely left in the hands of untrained healthcare professionals. This large gap in children's pain care leaves both the healthcare professionals as well as patients and families frustrated. Data clearly shows that untreated or poorly treated pain in children leads to a much higher incidence of refractory chronic pain that lasts into adulthood, much higher incidence of mental health diagnoses, and a massive societal burden. It also leads to poor job satisfaction and poor job security for healthcare professionals. Proactive Pain Solutions Physicians Academy is the answer to this major problem, eliminating that large gap through our comprehensive evidence-based virtual training program that's bolstered by live Q&A sessions, personalized mentorship, and leadership development. The limited time enrollment is now open and it offers a limited number of spots. So join our academy today and know what it's like to have the expertise at your fingertips while you enjoy the professional satisfaction and the job security that you deserve. Join us at www.proactivepainsolutions.com.